Thank you so much. That was a phenomenal set of presentations. I want to ask people to line up at the mics for questions and to make sure our speakers know that we're being recorded, and so please do use the microphones. Jeff, take us away.
Hi. I'm not going to argue with Paula about who should or shouldn't do advocacy. But instead, I think each of your talks in different ways raised questions about the reward system in academia. And each of you were talking about having policy impact in a way that isn't measured through the number of peer-reviewed journal articles that you publish. So expound on, in a slightly more perfect, not a perfect world, but a slightly better world, how would we alter the reward systems within the academic environments in which you are working that would encourage academics to do the kind of work each of you is doing?
So, well, as Jeff well knows, he and I were just colleagues for 4 years here at George Washington University, and I recently made a move to the University of Michigan. But I'll say one thing in the School of Public Health at GW, if you look at the promotion, the criteria for tenure and promotion, you know, in academia, we think of the big triad. It's research, teaching, and service, and that's what you're evaluated on every year, and that's what you're evaluated on for promotion and tenure. At the Milken Institute School of Public Health at GW, there's 4 things. It's research, teaching, service, and public health practice. So it's explicit in how faculty are evaluated, again, annually, but also for promotion, that if you are doing work that has had a positive impact on policy, on practice, and again, you're not doing that work if you don't have relationships, right? So you have to invest a lot of time in that, but it's a way that gives people a signal, we value this and it's important. It's not enough for a single institution, however, to do that, because when it comes to the point, and I know there's a lot of younger scholars in the room, so I think it's important to talk about some of these things. When it comes to the point of when you're going to have your external reviews for promotion and tenure, and not other places are used to thinking that way, you can send them the criteria. Look at our school. We value these things. Maybe some of the other people outside looking at it don't value it the same way. But I do think, especially in professional schools and academia, we have to make this change, or I mean, we're becoming more and more irrelevant, I will say. And I hope many of you are staying around for the workshop tomorrow that's going on. And actually, Lisa Simpson, who's the president and CEO of Academy Health, is going to give a presentation tomorrow on some of these challenges, but also some things that are going on in Europe and in the UK in particular, where actually universities are, you know, somewhat being told, like, how are you going to demonstrate your, you know, worth to society? I mean, you can count the number of publications you do and this other academic sort of stuff, but what value are you bringing to society, especially publicly funded universities? We've got to figure out ways to measure more. What is our impact? What is the value that we're bringing to the world? Probably easier on the service and the teaching side, but in terms of the scholarship, why are we doing this, and what are we doing, and what value does it have? So,
I want to add one thing to that, which I agree with everything that you said. And I'll tell you, the mistake that I made early in my career was that I wasn't publishing enough, you know, and I sort of got resentful at some point, because I thought, you know, the type of research that I do, I could sit down and I could pull a bunch of national data sets and I could crank out a bunch of regressions and hierarchical models, and I could do that. It wouldn't be very rewarding for me, but I have colleagues who have made, you know, really good contributions to the field analyzing these very large data sets. They've sort of cracked open things that, you know, whatever, have led to other lines of research. It just wasn't the kind of work that I wanted to do. The mistake that I made was there were several things that I did that had publishable opportunities in them, but I didn't have that intention right at the forefront. And I sort of would sometimes get a little lost in the role that I was playing. Right? So I live in Baltimore City. I have 3 kids that go to Baltimore City public schools. So I go to a meeting as a researcher, and then I, you know, halfway through turned into some radical advocate, you know, like, you know, so it was kind of easy to get lost. But the 2 things that I will say is, I think The field is shifting somewhat. It gets complicated because you could be in a university where you have a particular culture and appreciation for people who are doing the kind of practice translational work, but review happens external to that university. So until the norm shifts in the field, it's still a little kind of sketchy. But the two sort of practical things that I would say for young people that are doing this is you can publish this kind of work. We have practice-based journals. Hopkins has a journal, Progress in Community Health Partnerships. You can actually publish with your community partners. And so you can't really get away from that. That's a part of the field. If you choose to wear the hat of an academic, that is an academic requirement. The other thing that I created for myself as I move up for promotion is the practice portfolio. And it's funny, I'm at Hopkins. Teaching is sort of the thing, you know, I do like once 9 weeks out of the year because I'm sort of required to, but, you know, I'm 85% soft money, and I love teaching. I don't have a teaching portfolio because I'm not going to get promoted at Hopkins based on my teaching. I'm going to get promoted on my scholarship and my grantsmanship and my publications and those things. And now we have a new dean of public health practice, so they decided it's important. So I don't have a teaching portfolio, but I do have a practice portfolio that's actually substantially larger than my CV. So I think that's also kind of a formal thing that we can start to do, because it might not be obvious for people. And if they don't sort of get that, then you have to give it to them in a way that I think is very clear and digestible.
So you guys have answered sort of the push factors into integrating your research into public policy, and I was hoping that you could talk a little bit more about the pull factors and how we get policymakers to be more interested in your work, and what are some of the things we could do to incentivize that type of work.
I can jump in to try to answer that. So I think at the Red Center, I think it goes back to the points that have been made, I think in each of the talks around building relationships. I think if you do have some of those relationships and people know you're a resource that they can go to, there might not be something imminent at that moment that needs to be worked on, but over time, as things come up, I think there's pull from policymakers when they've had a good experience working with you and you know, they know you're knowledgeable and that you're willing, right? That you're willing to actually take the time, even though you're not necessarily incentivized to do it, to talk to them or get them data that might be helpful.
I'd just like to add on to that question and ask if our panelists can talk a little bit about how you actually form those relationships or how you find those people. I think when your bread and butter is research, having sort of the time to follow what's happening in the policy space and to figure out who the decision makers and the key actors are is a tremendous challenge.
So one thing I've always done is look for ways that my teaching and my research can inform and help each other to be efficient, but also, I mean, they shouldn't be in these separate spheres. And some of the things I've taught over the years, like program evaluation and policy analysis, it works well if the students actually have real life clients and real life programs and organizations that they're working for. And if you go out and try to form those relationships around opportunities for your students, and you have and your students deliver, that's important, and don't flake out on them. But if your students do good work and they know you and they trust you, then then lots of opportunities might come your way. But a lot of work that I've done with community-based organizations and local public health and state health departments has started around opportunities for students, and then come and say, hey, we have this project, would you like to get involved with it?
Yeah, so when I first started out doing this, I really lucked into this because I happened to go to a place that was really focused on this. My mentor had, made an effort to develop these relationships. He'd been around for a long time. He was very generous about connecting his graduate students. So some of it for me was just the luck of having that situation and benefiting from other people's relationships. Now, as time progresses, more and more people within the obesity policy world know that I have an interest in doing this kind of work, so some people reach out. And then for example, I just moved to Philadelphia. I switched universities universities, and I got to Philly and have started to reach out to figure out, okay, I just had a meeting at the Department of Public Health. It's amazing. People are very responsive to emails. I find if you say, I'm a researcher, I would like to be helpful, and now I'll give a talk there, and they'll start to get to know me, hopefully. So I do think we feel like there are these really big barriers to making connections with policymakers, but I've found more often than not that people are actually eager for researchers to say, I'd love to dedicate some time to be helpful to your efforts.
Excuse me, Dave Kindig, University of Wisconsin. Thanks for a great panel. And I just wanted to make a comment, underscore Professor Roberto's idea of strategic science, which actually I had not heard that term until today. I'm more familiar with John Lavis's knowledge exchange relationship, sort of push-pull exchange. But I think the fundamental idea of that you pointed out is that it's actually the using organization that has the question and maybe the data, and it's the job of science to sort of organize it and point towards reasonable conclusions. And I just think that's a really important idea to keep in mind, particularly as your group here moves forward. And to your point, that stuff, if well done, it is science and it can be published, and there are good examples of young folks and old folks who have done that. So thank you.
I'll take the moderator's prerogative and ask more questions. And please come up to the microphones because we have some time for discussion. But I wonder if I love this idea about staying ready, but that seems like another really big challenge. And Christina, you talked about the need to be able to do this rapid response kind of work. And I'm just wondering if you guys can talk a little bit more about how you do that, how you sort of create space within your academic portfolio to do rapid turnaround work, or the importance. I know you mentioned funding, but that kind of work doesn't really line up with even foundation funding timelines, let alone most federal funding timelines. So just would love to hear more about that.
So one of the things I'll say about staying ready, probably the most transformative thing that I did in my career was accept that I needed a full-time analyst on staff at all times. So I have an analyst and I have a GIS expert. Policymakers love maps. They really do. They love maps and they love pretty pictures. And we make maps that look like really pretty pictures, and they're very compelling. And so one of the things that I do in the world of staying ready is we have the human resources that are mostly funded out of soft money. They're mostly funded out of my grants. And so, sometimes we might be working on something that's tangential to a project, but we have that skill set in-house. The other thing is, and this sounds really silly, but I love working at a local level. I read the Baltimore Sun every day. I am very clear about what's happening. I sort of have a pulse on things. I'm now very connected, sort of socially and politically. And so, as I'm thinking about not only just the field and how the field is moving forward, I'm also thinking about how the landscape is shifting. And I'm kind of getting out in front of those things. So I think in line with what Christina was also talking about is that oftentimes a lot of the sort of projects that I've undertaken, somebody comes to me and says, look, this is what we're dealing with, this is what we'd like to have happen. And so I'm like, oh, great. And then I meet with my team, and then they start thinking about, okay, well, what are going to be the publications? We did an article for Rolling Stone on Felicia Barnes, who was the young woman from The Wire, and it was called Girl on the Wire. And they wanted all of this data on drugs in Baltimore because they couldn't believe that this woman who had gotten to this prominent role on the show had, when the show ended, had gone back to the streets and was caught with some very large quantity of drugs. So they asked us, and I was like, Rolling Stone, like as a nerd, I was like, I've arrived, I'm in Rolling Stone, right? So they could have been like, do 1,000 jumping jacks and 3 hair, I'd have did whatever they asked. But we actually, the work that we did for that Rolling Stone article, we published. We published our academic version of Girl on the Wire. And it was like putting drug involvement in a context or something like that. And so, yeah, I think one of the big things for me is to make sure that I've got my human resources in place and that I've also sort of got my other kind of ducks in a row professionally, academically, such that I can actually have the time to do that. You know, so if when I'm up on my other work, when I'm on top of my grants, when I'm producing at the level that I should be, it actually gives, it's like buyout time. You know, other people buy out of teaching with research. I sort of buy out of research with publications so I can do some of the policy work.
And in terms of the relationships you want formed and ready, I would say, I mean, if you're not so lucky to have in your own research center, government relations and media relations and communications staff, find those people at your university and make sure you have good relationships with them. I mean, lots of places offer media training and all, and I think you should take advantage of that because it's important, but really have relationships with those people who actually, it's their comparative advantage. It's not most of ours. We weren't trained to do that stuff, but they are. But let them know who you are, what you're working on, even what some of your colleagues are working on, because then when these opportunities arise, you already have that sort of working knowledge and you can pounce. Because in the policy world, we know windows open and they close very fast. And if a window opens, our data aren't quite ready. I'm really busy right now. I have a new course prep, and I'm writing a grant, and then you're going to miss that. But those people can really help you move those balls forward. You don't have to do it by yourself.
Hi, Dorothy Daly from the University of Kansas. Thank you for a great panel. These were really interesting presentations. I'm wondering if the panelists can talk a little bit about difficult conversations. Whether, Dr. Furr-Holden, you mentioned you learned to tread lightly. With the alcohol lobby, whether it's vested interests or tensions of the role of government, how do you have those conversations and start to develop more productive relationships?
So I can just,
Have a brick thrown through the window.
yeah. Well, that I will say that is the function of one really bad actor, and I get really passionate about this stuff, but I will say. Being authentic, you know, is probably the cornerstone of all great relationships. I think all great relationships are reciprocal, and my experience of great relationships are when people are being authentic. So I make it a point to be very authentic and transparent with people. I don't pretend, you know, and I love the way you said, I feel like you gave me permission that I don't have to be neutral. I mean, I think about work that's sort of hypothesis driven, but that's a little bit different because I do know some folks that I feel like they have an agenda, and as a researcher I don't want to have an agenda. I want to sort of be unbiased and do rigorous work and let the research speak for itself. But then I'm like, but I actually have an opinion on this, and I have a point of view, and I actually have a position, and I do think we should move in certain directions. So I'm authentic with people, and I'm very transparent about that. And when possible, I typically do not throw people under the bus. And if I'm going to throw you under the bus, I'm going to give you a heads up. So we published in the Sun a list of all of the campaign contributions that all of our elected officials had got from the liquor lobby. And I let each one of them know that that was coming so they could figure out how they were going to spin it. They could do whatever they wanted with it. But I said, we've got to sort of apply some pressure here. And the citizens need to understand why their folks are not moving on getting rid of some of these problem liquor stores or decreasing the density. They need to understand that. And it was really disgusting. So in Baltimore, a company can give you $6,000 and an individual can give you $4,000. There were some people that had the liquor store as a company give them $6,000. The owner, his wife, and their 2 children then gave them another $4,000 each. I mean, people were just being bought and sold. So it took a lot of work for us to go through and figure all this stuff out. And before we published it, I sent it to them first, and I said, it's coming, and it'll be in tomorrow's paper. You didn't get a lot of notice, but you've got 24 hours with your people to figure out how you want to spin it. You know, and I'm really clear, and people know, if you want to, if you want advocacy for businesses in Baltimore, I'm there. I'm not going to advocate for liquor stores. With the Freddie Gray riots and some of the places that were burned out were liquor stores. It's so sad, but like serendipitous at the same time. 23 of them were non-conforming. 23 of the businesses that got burned out were liquor stores that were in residential communities and shouldn't have been there anyway. And the city provided, I know it's just like, and the city provided funding for, and loans and other kinds of supports for the other businesses to rebuild. The pharmacies, the dry cleaners, the corner stores, and they refused to provide funding for liquor stores. They were going to. And I went on record as saying, if you give money to a non-conforming liquor store to go back into operation in that location, in a non-conforming location, I think the drug dealers who got displaced should also qualify for microloans, because that's as illegal as the liquor store being there. So, yeah. That got their attention.
So I'm Bruce Lake from, actually, University of California, Riverside. But anyway, this was really exciting for me, and I wish I was tons younger. I'd want to be like each one of you. It's really, really cool. I wanted, though, to point out what I took, and it might be wrong, there's tensions in between you on two dimensions. One of them is the advocacy versus the I forget what your thing it wasn't equal to, Paula, but it sounds policy scholarship. It seemed like Debra really wouldn't have been able to achieve what she achieved without some advocacy, and so I wondered about that balance there. And I wondered, Debra, whether you think of that as advocacy. It sounds like it to me, and I want to say, great, keep doing it. So, but anyway, there's that one. The other one is the focus on policy's capacity to produce inequalities. So Debra's very much focused on inequality right from the start. The other two, I was thinking that when you implement, so the strategic science, you go to the policymaker's making up the idea, and they have their frame that they come from, and it's probably not poor people. So the kinds of things they're conjuring, then you're going out and giving evidence about it. So that's good, but it might help overall population health. I wonder whether you've thought about ways to focus on the production of inequality. So giving that kind of information, does everybody benefit on the calorie counts? Does everybody benefit equally? And that focus. And Paula, did your group focus on what the impact would be of changing on disparities in smoking, inequalities in smoking?
I want to say, I want to take a course with Paula, because when you had that slide up, I literally wrote policy scholarship versus advocacy. Like, this is an inquiry for me. Like I said, I was trained as an epidemiologist. I'm like, I can do things with numbers that would like make your head spin. This is like a new sort of world for me, and I think as it evolves, it's important that we have language. So, we had a little bit of interaction before this. I looked up some of your work around strategic science. That was a term that was new to me also. I think these are areas, I don't have it all figured out, and I probably am a little too far on the advocacy side, but I like this whole idea and notion around policy scholarship, because I also don't think I would wish my career on a lot of other people. I've learned a lot of things the hard way, and things that I think could have benefited me personally, professionally, have taken longer because I've chosen to do things this way. So it would be nice to have language, training, senior mentors who've sort of navigated those waters. And I very much want to be that person for young scholars to help them navigate that.
I have no doubt that you are. No, and I want to hang around with both of you, so we're going to talk after this, but this has been a fun panel for me. To Bruce's first question, because I was rushing, I perhaps wasn't quite as articulate as I want to be, but so in some of the circles I run in, I do talk to a lot of younger, doctoral students and postdocs and younger faculty members who, outside of being in a department that has the word policy in it, a lot of people say, oh, I'm not going to do policy, and they actually think policy and advocacy are the same thing. So one of the points I wanted to make is that they're not the same thing. And then where I was sort of rushing, I think I did say, I'm not telling you not to do advocacy, but it's difficult to navigate. Again, a lot of us are not trained in doing that, so you're going to know enough just to be really dangerous and bad at it. So bring in the experts, understand your environment and what the incentives and disincentives are, work to change that environment, because we could do so much better on it. So I think we're all in the same space and thinking about it in the same way. So again, I'm not telling people not to do it, but it's some challenging waters to navigate.
In response to the inequality issue, yeah, so that's obviously top of mind for anyone in population health when you're thinking about policies and the best policies to implement. With the strategic science approach, I mean, in my ideal world, there's 15, 20, 30 centers that could all mobilize and ask different aspects of the question and test it in different ways. In my one small case study, I mean, we did actually recruit from a range of different socioeconomic backgrounds. So in terms of our actual study design, we were thinking about it and we didn't see differential effects, but I had a pretty small study. Now, that being said, menu labeling has played out. There's been lots of evidence showing it does work, it doesn't work. It's starting to seem to cut across socioeconomic lines. Maybe it works, it's more impactful in, higher SES customers. So it's hard. I think where I was at, I couldn't answer all the questions at once. It was something I can contribute then. What I'd like to see this move to is more coordinated effort with lots of groups doing this, so lots of questions could be asked rapidly at once and bear on all the issues, including inequality.
Hi, I'm Hetty Lee. I'm from the University of Washington. I have one comment and then a question. One is just a plug for the Scholar Strategy Network. It's a national network that can also help scholars provide or connect with policymakers that are interested in their research and connect with other scholars that are doing research. It started at Harvard, but there are nodes all over the country. Some people in this room are part of the Scholar Strategy Network, and anybody can become a member through a couple of different things online, so you should look it up if you're not familiar with it. And the second question I had for you was about spin. So when I was being trained, my advisor always warned me about, that you have no control of your research once it's gotten into the hands of the media and other policymakers. And so she gave me the example of she did work a long time ago using the PSID to show that women who were on welfare were also working. And her point in that research was to show that welfare wasn't meeting the needs of families, so women had to work under the table to meet the just daily needs of life and to take care of their families. But her work was then used by many different types of policymakers to promote more stringent welfare to work policies, right? And so she always sort of kind of warned me about that. And I was just wondering how that fits into this discussion about policy scholarship versus advocacy. Do you have control over your research? Do you want to? Do we have control over the spin? Should we? How do we do that? How do we navigate that? I know it's a big question, just curious.
I think it's a very hard thing to control. I do think that happens. I think the best chance you have of having control is being the one that's writing the op-ed, is at the hearing testifying, is actually authoring the policy brief. I think that's as much as you can do, and then there's a certain extent that you just can't control.
Yeah, and if anyone has figured out a way to control headline writers, let me know. because even if you end up having a nice relationship with a reporter, you're a go-to person. If you have a nice relationship, they actually might sometimes let you read their copy. You might actually, give them the quote and edit the heck out of it before. But then someone writes a headline that's totally different. So yeah, you do, getting your stuff out in the public domain, you do lose some control. I think you have to not just get totally frustrated by it, because it's going to happen. But this sounds trite, but my media relations friends say, again, no coverage is bad coverage, no publicity is bad publicity. So the more, especially in our rapid fire information age right now, I'm going to say something now I never thought I would say. I'm dabbling a little on Twitter, and my new communications people are like, you don't know what the hell you're doing. And I tweeted a couple things today, and the guy sent me an email and said, we need to set up your next session. Because I had a typo on someone's name, So anyway, I'm going to get Twitter trained, and this is not the be-all and end-all, but for those of us who are really in academic settings, but we want to get information out, we want to learn how to engage. Look, if you want to engage with staffers on committees, you're going to have to communicate in these kinds of fora, and yeah.
And not to be too pop culture, but I don't know if anybody watches Scandal. But the season premiere just came out, and I thought it was just brilliant what they did. They actually got it out in front of it, and she had this like eureka moment. So for anybody who hasn't seen it, I won't be the spoiler, but the point is, they knew that there was a story and some pictures that were going to hit the front pages. So they put their own pictures out on the front pages. I mean, it's sort of like, you know, I just had, and it's so funny, the second paper I ever wrote was on drug use among welfare recipients. And the point that I was making was that we could actually identify which people in the system were at greatest risk for drug use. And because they were a part of a public system, it created an opportunity for intervention that otherwise might not have been present because they would just be in the general population. And of course, someone took that and used it as a case for saying we need to cut benefits because, you know, more people on welfare are on drugs. And I mean, I was like, and I was like, how did this happen? But it's interesting because when I went back and read the article, it made perfect sense to me why that's what they took from it. So I almost feel like we also could be a little more thoughtful in both the questions that we're asking as well as the way that we're writing. You know, I read my papers now before I submit them with the thinking that if somebody just lifted half of the sentence, could they have my research be misrepresented in a way that actually is the opposite of what my intention was? Yeah. So I think there are some, and we've probably all done that, but I think there's some intentionality that we could bring to it that would also minimize that.
I had a comment on enabling or helping junior faculty to do policy relevant research. And particularly for those of us who are at public universities, I think there's a lot of misconception among junior faculty about what you are and aren't allowed to do, right? So at state universities, you're told you can't use, as a state employee, you can't engage in advocacy, you can't engage in lobbying. That includes things like using your university email. So I have brilliant colleagues who are doing policy relevant research who are terrified of sending emails to legislators or who, for fear of, right? And so I think that just a practical suggestion is that these big public universities, why aren't you educating junior faculty? Because it's absolutely not true that you can't email a legislator or that you can't write a policy brief or that you can't write, but I think that there's just a very practical, and if anybody had thoughts on that.
That's your government relations people should be very helpful. Explain to what is the definition of lobbying, what can you do, what can't you do. But doing that training in a way that's more positive, like here's what you can do, but just know the limits, be careful. Don't send out an email to everyone inviting them to your house for a candidate support party. Don't tell everyone how to vote on some, people do stupid kinds of things. But yeah, no, I agree with you that people feel constrained, but you don't have to be.
I'm Carlos Mendez de Leon from the University of Michigan. Thank you for a very interesting panel. But as I was sitting listening to your presentation, I was wondering about the following. You all talked about specific policy issues and policy opportunities within very local spheres, at the state level, city level, municipality. And I'm wondering what the long-term consequences of this work are. Will we have, in 20, 30 years, a patchwork of policies aimed at improving population health that vary enormously from city to city, from state to state? We have a tobacco legal access age in Hawaii of 21, but 17 somewhere else. We have policies related to alcohol outlets in Baltimore, soda beverage sizes in New York City. Where is this going? And my specific question is this a strategic choice so that we can act on very local issues, local challenges, and perhaps local opportunities, and we do this on purpose? Or is this just a consequence of the lack of effective federal policies in with a somewhat dysfunctional, and perhaps by the end of the week, non-functional federal government? Are we doing this on purpose, or is this we have no other choice because at the federal level it's just too hard to get anything done? I'm wondering about it.
I want to say something about that. I think that's a great point. So I personally feel like what's happening in City Hall in Baltimore is far more impactful over my life than what's happening in the White House. Like, not that what's happening there isn't impactful, but what's happening, I just was in Flint, Michigan, which I lived there for 2.5 years as a teenager. it broke my heart. They just changed their water supply. They just did a big press release. It's riddled with lead. The governor has declared a state of emergency there and implemented an emergency executive. So democracy is out of the window in Flint because their mayor is, in essence, completely impotent now and has no real power. They turned Flint from a little democratic city that was struggling and trying to get better and heal itself into a little purple town where the Republican governor has taken over, and all kinds of things are happening there. And I'm like, people need to deal with that at a very local level. I don't think there's a federal policy that's gonna, by the time it trickles down to Flint, that would actually make the difference. It's interesting because the way the US has always been organized is we've got this sort of big umbrella of policies that we think are the blanket that everybody needs to fall under. But I do think it's really important that people have very much local control and that they have the opportunity at that local level. The thing that I think would be better is if instead of, you know, like I said, what I'm doing in Baltimore is very relevant for other places. You look at a city like Philadelphia, demographically it looks very similar to Baltimore, but how they control liquor in Philadelphia and in the state of Pennsylvania is so dramatically different from how it's done in Baltimore. I don't know what Philadelphia will be able to glean from what I'm doing in Baltimore, but it absolutely is very relevant for Detroit. So I think what's more important is not that we sort of have some master plan that then gets dropped on everyone, because places like Flint, it'll never make it to them. I think we need like a combination. We talk about the upstream, downstream. I think we need a better sort of interweaving and connection, and there should be some incentive. If you are getting funding from NIDA to do clinical trials work, you shouldn't be allowed to do that in a vacuum. You should have to coordinate with the network of other clinical trials researchers. I think there are ways connected to money to create an accountability where we don't have some patchwork policy system. But I very much think it's important that people at a local and state level have some control, and that the federal policies really be the big ones that provide a blanket, but that they don't smother the places like Flint.
I wholeheartedly agree with everything you said, and there's a lot of political scientists in the room, so they could come up here and do, you know, what we know about policy dissemination and how states and localities learn from each other and how things spread and scale. But an important part of that is there has to be communication and willingness to learn from others. But the other, you know, real thing about the U.S., I just gave my lecture to my students on, you know, the legal basis for intervening on the health and safety. And actually the way the US Constitution is set up, there are real constraints upon what the federal government can do and bring down upon the states. So a lot of things in the realm of population health are gonna have to happen at the state and local level. The federal government, because of the way this country has been designed, cannot happen. And I think it's probably a good thing because it's such a big place.
Also, I'll just add, local level changes can spur federal level changes. So calorie labeling is a good example where it happened in New York, and Seattle wanted to do it in Philadelphia and San Francisco. The restaurant industry didn't want to have to do different things in different places. They actually ended up getting behind a federal policy. So, you know, I think of course we need both, and it doesn't mean that at the local level it's not going to actually translate to something bigger.
I have a question following up on that, which is when something happens at the local level, sometimes it's so local that there's not the infrastructure to do an adequate evaluation. It would be really helpful if some of those local problems could be solved well, and they are, but then also be able to somehow produce the data that could make for larger policies so they could be replicated. And if you have any suggestions around that, I'd love to hear them.
So I agree wholeheartedly with that, and I think that's why there's a very critical, important role for researchers and academics at the table. You know, so I don't necessarily have the answer, but I think that's why we need to be at the table. I make no bones about it. I am very much a data person, you know, and I also realize that data in and of itself, I mean, if you think about it, a lot of the major sort of health, you know, kind of public health, population health problems that we sort of have the data to substantiate those problems. So
poverty's bad.
Yeah, exactly, right? We don't need another, I don't have to go and say, we know certain things. But I think it's why the researchers need to be there. Because the other thing is, I think some of the things that we think intuitively are good, if you looked empirically, it would be something else. So I think it's a point well taken, and I think that's why researchers need to be at the table wearing their white hats.
Thank you.
Yeah.
Thank you very much to our panelists and this audience for the great questions.